Taking a break from cooking right now to talk about something that is actually, very, very common these days. We're talking a little bit about tattoos and removing them. And Dr. Peter Katz is a board-certified dermatologist with Dermatology Associates. And you say you get asked all the time, this has become very, very, very common, where someone gets a tattoo and all of a sudden, after a while, they don't want it anymore. Correct?
Absolutely. We're seeing it all the time. Probably the biggest age group is probably in the 25 to 40-year-old age group. But yeah, I'm seeing anywhere from 1 or 2 to 5 or 6 tattoo removals a day. So becoming pretty common.
It used to be that you got a tattoo, you're stuck with it. I mean, that's it. It's not going anywhere. Now there are some options. Let's talk about the different options about removal.
Sure. And some of these things people have tried for years, scrubbing it off, essentially.
That's not going to work, right?
No, not going to work very well. Dermabrasion is what that's called, is the kind of technical term for it. And you can get some of the superficial tattoo off with that. But the deep portion of the tattoo that the artist puts in there with the needle doesn't get out, and it just looks like a blurred and scarred tattoo.
I'm thinking it's going to hurt too.
And it hurts. They probably numb it up first, but other options. There are some things over the counter. You see these creams. Something called wrecking balm is one of the options, and it's the same thing. Kind of scars the top of the skin, gets rid of that superficial ink, but doesn't get to the deep part where you can really kind of almost erase the tattoo with the tattoo laser like we have.
Now let's talk about that. So that's the new in thing, are these lasers, and it really works. Tell us more about the laser and the treatment.
Absolutely. There's a few
We
different...
have a picture here, so...
Oh, here, you'll see a progression here. If I'm not sure if you're going to show the whole thing. This patient actually went through, this is probably after about 3 or 4 treatments, and she went through a series of about 8 treatments, and she had a great result after just 8. You couldn't even see it. There was ever anything there at all after 8 treatments, even if you got your face right up next to it. We do get this result with a number of patients.
And here's the final. So you saw the
this is not the
tattoo.
final. No,
Here
it keeps going.
Here it is.
Here's the final. Yeah.
Wow.
So the Q-switched alexandrite laser is the one that we have. There's a couple of different options. There's a Q-switch ruby laser, Q-switch ND-YAG laser, but the Q-switch alexandrite, the Alex Trivantage is the one that we have. It's a laser that's dedicated to the removal of tattoos, and that's what it's meant for. A lot of these other lasers, they're meant for other things, hair removal, and people kind of use them for a tattoo removal. In my opinion, if you want to get your tattoo removed, get it removed with a tattoo removal laser. So
how many treatments did that take, and does it hurt? Obviously, she was a happy camper when it was all done.
She was a happy camper. It does hurt. I'm not going to lie about that. There is some pain involved. Some people say it's in the range of a hard rubber band snap, like when your big brother snaps you with a rubber band. But some people say it's more. Some people think it's maybe even a little bit more painful than getting the tattoo on. So we do have some options. There's creams, there's anesthetic creams. We sometimes will numb the area with the local anesthetics as well. It's all about the patient's comfort level and what they want.
And in and out, I mean, it's not one of those deals where they have to take time off work?
No, absolutely. I usually see initial consultations. I see a free consultation if you want to come in and just talk about it. No obligation to get it done. People come in about 11:45 and, maybe over their lunch hour or something, we talk about it, and the treatment itself takes 5 minutes in most cases.
Really? Wow, that's amazing. So come a long, long way. You guys are the folks that are doing it. For people who are interested in even finding out more about this, how can they get a hold of you?
Well, we do have some information on our website, dermatologyassociates.com. And you can also go on the website of this laser that we use and that I suggest is the Q-switch Alex Trivantage is the laser. You can just put that in Google and that'll pop up. It's pretty easy to find. There's lots of information on it. They'll give you some examples of progression. You can even see treatments as they're done, you know, the snapping of the laser as it works. So
very cool.
A lot of
Yeah.
information online
Very
too.
cool, and I mean, it can be life-changing for people who, you know, maybe want a certain job that they couldn't get with that tattoo, you know.
Absolutely. I see a lot of people that come in. Probably the second most common reason people come in is because they want to get into the military, or they have a job that they don't want it showing. It's on their hand or it's on their neck, and it was a decision they made when they were younger, and now they want to get that taken care of. So.
All right. Thanks so much, Dr. Peter Katz, Dermatology Associates. Appreciate it. Thanks.
No problem. Great to be here.